right, so we're still in spinal anatomy. These are the beginnings of the back muscles on page 72 of Chiro Essentials Boards Part 1. All right, let's go through it. First run through. Back muscles. The muscles of the back are arranged in several layers. Extrinsic are superficial and intermediate. Intrinsic are superficial, intermediate, and deep. Never heard it broken down in that exact way. That's interesting. The extrinsic superficial layer is made up of trapezius and lat dorsi. The extrinsic intermediate layer is levator scap, rhomboid major and minor, serratus posterior, superior and inferior. So all the serrati are part of the extrinsic intermediate layer. The superficial intrinsic layer, there went my pencil, time to resharpen. This new pencil sharpener is not all it's cracked up to be, but hopefully it can work. It's not sounding good. Oh my gosh, no, this is terrible. It's really bad. Oof, goodness gracious. It's breaking the whole pencil. Oh my gosh. Oh, sigh. So much for buying a new one. Can try the old one. I think I should maybe try to keep going because the lead is staying in place. So thanks, Amazon, for living up to your standards. Okay. I'm gonna stop complaining and get back to these back muscle arrangement layers. The superficial intrinsic layer contains splenius capitis, splenius cervicis. The intermediate intrinsic layer contains erector spinae. The deep intrinsic layer contains interspinalis, rotatoris costarum, intertransversalis, multifidus, and semispinalis capitis and cervicis. So the deep intrinsic layer has many parts, a lot of them small. All right, erector spinae. Is that all in view? Yes. Arranged in 3 parallel groups for the erector spinae from lateral to medial, iliocostalis, longissimus, and spinalis. Each of these groups is further subdivided into 3 subgroups, iliocostalis lumborum, thoracic, and cervicis. Longissimus thoracic, cervicis, capitis, and spinalis thoracis, cervicis, and capitis. There are architectural and functional differences in the thoracic and lumbar portions of these muscles. Bogduc et al. Recommended further partitioning of the lumbar and thoracic portions of longissimus thoracis and iliocostalis lumborum into the following. Oof, this seems like overkill, but okay, let's look at it. Longissimus thoracis pars lumborum, which attaches to the accessory process. Longissimus thoracis pars thoracis. Iliocostalis lumborum pars lumborum. Iliocostalis lumborum pars thoracis. The lumbar component of these muscles function differently than their thoracic counterparts. Their line of action is not parallel to the compressive axis of the spine, but rather in a posterior caudal obliquity, causing a posterior shear force together with an extensor movement of the superior vertebrae. The fibers of the thoracic portion of these 2 muscles run parallel to the compressive axis of the spine, and this results in greater extension with minimal compression. The erector spinae muscles are supplied by branches of dorsal rami of the segmental spinal nerves. On to multifidus. Is that view? Yes. Multifidus means many splits. They're the most medial of the lumbar back muscles. They originate from the sacrum, lumbar mammillary processes, thoracic TPs, and articular process of the lower 4 cervical vertebrae. They attach to the sides of the SPs of the vertebrae 2 or 3 levels above. They work differently from the more lateral extensors, especially in the lumbar region. They affect local areas of the spine, producing extension, lateral bending, contralateral rotation. These muscles are loaded with mechanoreceptors, acting more in providing info in initiation and correction of the movement at that specific spinal motor unit level, less than the actual movement of the spine as a whole. All right. Let's get this up. Intertransversarii and interspinalis. Intertransversarii muscles are divided into medial and lateral components. Only the medial compartment is considered part of the true back muscles, as they are innervated by dorsal rami. The lateral group is innervated by ventral rami. Yeah, that doesn't sound like it backwards. The interspinalis are small, short, paired muscles that lie on either side of the interspinous ligaments. The function of the small intrinsic muscles. Oh, this is the whole section. Okay. The small intrinsic muscles are too small to cause any significant extension or rotation of the spine. The main function of these small muscles, like Multifidus rotatoris, Interspinalis, and Intertransversalis, are to serve as mechanoreceptors, as they are packed with muscle spindles. Also, they serve to stabilize the vertebrae during local movement. Okay, got that in view. Other important muscles acting directly or indirectly on the spine. Glute max, origin, ilium, sacrum, coccyx, sacrotuberous ligament, and thoracolumbar fascia. Yes, it's huge. Insertion, gluteal tuberosity of the femur and iliotibial band. The IT band is the 75% insertion. Innervation, inferior gluteal nerve, L5S1S2. Action, extends, externally rotates thigh. Infraspinatus. Origin, infraspinous fossa of the scapula. Insertion, middle facet of the greater tuberosity of the humerus. Innervation, suprascapular nerve for infraspinatus, not C5, C6. Action, externally rotates the humerus. It's a rotator cuff muscle. Lat dorsi. Origin, thoracolumbar fascia, spinous processes of the lower thoracic and lumbar vertebrae. Insertion, floor of the bicipital groove. Innervation, thoracodorsal nerve, C6, 7, and 8. Action, adducts, extends, and medially rotates the arm. They call it the handcuff muscle. Levator scap. Origin, TPs of C1, 2, 3, and 4. Insertion, superior angle to the root of the spine of the scapula. Innervation, dorsal scapular nerve, C5. Action, elevates the scapula, connects cervical spine with mandible through omohyoid and mylohyoid muscles. Temporomandibular joint dysfunction might be related to upper cervical joint misalignment. Yeah, that seems a little off topic, but it's true. Obliquus capitis inferior. Origin, spinous process of C2. Insertion, lateral mass of C1. Innervation, suboccipital nerve, dorsal ramus of C1 spinal nerve. Action for obliquus capitis inferior, rotates the atlantodental joint. Obliquus capitis superior. Origin, lateral mass of C1. Insertion, lateral half of the inferior nuchal line. Innervation, Suboccipital nerve, dorsal ramus of C1 spinal. Action, lateral flexion of the atlanto-occipital joint. So as major, origin, bodies, IV discs, TPs of L1 to L5, insertion, lesser trochanter of the femur, innervation, L2, 3, and 4 from the lumbar plexus, action, flexes the thigh and trunk. Quadratus laborum, also known as QL, origin, iliac crest, and iliolumbar ligament, insertion, 12th rib and TP of L1 to L5, innervation, ventral rami of T12 and L1 to L4 spinal nerves, action, unilaterally lateral flexion, bilaterally depression of the thoracic rib cage. As a massage therapist, I find these muscle sections pretty fun. Rectus capitis posterior major. Origin, spinous process of C2. Insertion, lateral half of inferior nuchal line. Innervation, suboccipital nerve. Action, extends, rotates the atlanto-occipital joint. So we're at 11 minutes. I think it's a good stopping point, but there's only one more page of muscles before it changes topics, so I might actually do this as a really long video. I kind of think that's the best option here. Let's power through. Okay, can we see everything on the page before I dive in? There it is. Okay. Rhomboid minor. Origin, nuchal ligament, spinous process of C7 and T1 vertebrae. Insertion, root of the spine of the scapula. Innervation, dorsal scapular nerve C5. Action, retracts scapula. Rhomboid major. Origin, spinous process of T2 to T5 vertebrae. Insertion, medial border of the scap, below the root of the spine of the scapula. Innervation, dorsal scapular nerve C5. Action, retracts the scapula. Spinous capitis, origin, nuchal ligament, spinous process of C7 to T3. Insertion, mastoid process. Innervation, posterior ramus of C3 and C4 spinal nerves. Action, unilaterally rotate and laterally flexes the neck, bilaterally extends the head. Splenius cervicis, origin, is it still in view? Yes. Spinous processes of T3 to T6, insertion, TPs of C1 to C3, innervation, posterior rami of the lower cervical spinal nerves. Action, unilaterally flexes and rotates the neck to same side, or ipsilateral, bilaterally extends the neck. SCM, also known as sternocleidomastoid, origin, mastoid process, lateral third of the superior nuchal line, insertion, manubrium of the sternum, and medial third of the clavicle. Innervation, spinal part of cranial nerve 11, is the motor, and ventral rami of C2, C3 for proprioception. Action, tilts the head, ipsilateral shoulder, rotates the head opposite. Acting together, they extend the head at the atlanto-occipital joints. I don't need to read the rest of that paragraph. Okay, supraspinatus. Origin, supraspinous fossa of the scapula. Insertion, superior facet of the greater tuberosity of the humerus. Innervation, suprascapular nerve C5 and 6. Action for supraspinatus initiates abduction, which is the first 15 degrees. This is one of the 4 rotator cuff muscles. Trapezius, origin. This is a big one. Let's make sure it's in view. There we go. Trapezius originates at the medial third of the superior nuchal line, external occipital protuberance, EOP, ligamentum nuchae, spinous processes of C7, and all thoracic vertebrae. It inserts into the lateral third of the clavicle, acromion, and spine of the scapula. Innervation, spinal part of cranial nerve 11 for motor, branches of C3 and C4 for proprioception. Action, shrugs shoulder, retracts, rotates scapula. And the last thing on this page is the Thoracolumbar Fascia. It's 3 layers. Posterior is the thickest, middle and anterior is the thinnest. It provides attachment for lat dorsi, glute max, and transversus abdominis. It has 2 compartments, one which lies between posterior and middle layers and contains the erector spinae muscles, and another compartment which lies between the anterior and middle layers and contains quadratus lumborum or QL muscle. Transverse abdominis, also known as TA, and internal oblique, IO, are attached to the lateral edge of the thoracolumbar fascia. And here's a graphic with the layers: anterior layer, middle layer, posterior layer. All right, that's the end of that video.